From the News Channel 5 Network, this is Openline.
To our lines right now. So, Sandy, we do appreciate you calling in this evening. Thanks for your patience. Do you have a question or a comment for Dr. Horwat?
Yes, thank you very much. I do. I had my two front teeth capped when I was about 8 years old, and they remained intact until I was around age 30. And at that time, one of the caps broke, so I had them recapped at the time. And except for an occasional cavity, I never really have any problems with dental problems with the caps that I have. And I am now 60 years old, and I'm wondering, should I be considering having them looked at for replacement again, or how long do they last, or should I be concerned if my the general dental health is pretty good?
Well, I think you should go to your recall visits twice a year. Go for your cleanings at those recall visits at least once a year, if not both of those cleanings. But I did mine. They'll check you out at least once a year, and they should check out the integrity of what you have in there now. The fact that you started out doing this when you're 8 years old and you're 60 now and you still have them, I think that's fantastic.
I've been very pleasantly surprised myself, but lately I've been thinking, well, they are getting kind of old, so I just wasn't sure if they had a shelf life, or after a certain number of years they should get replaced or what. But
your dentist will check the integrity of the caps. They want to find out that where the edges of those caps are meeting a tooth, the edges of it, the margin is what we call it. They're going to probe that area, and they're going to make sure that they're not leaking at all.
Okay.
If they are leaking, they're going to want to replace them. If they're not leaking, your better options to leave them alone. Every time you have those redone, you're compromising the integrity further.
I see.
So if you got 20 years out of them the first time, I'm not confident you're going to get 20 years out of them the second time. The fewest amount of times you go in there. Now, also, too, technology changes over time.
One of the things, Dr. Horwat, that I think we hear a lot are what I would really kind of call the myths of your profession. And so I just wanted to go over a couple of those. And again, if you do have questions, comments, make sure you give us a call at 737-7587, and we'll get to as many of those calls as we can. But one, when you think of root canal, the myth is root canals are painful. So, fact or fiction?
Well, geez, it depends on the case, of course. Root canals don't have to be painful. Most of them are not painful. It just depends on what's going on in there. And we can always go through things like nitrous sedation. We do oral sedation at our office as well. In cases where if someone has a lot of anxiety, we can always go under IV sedation or general anesthetic if we have to go that route. We can do that as well. But I'm going to say almost 100% of the time, we just use local anesthetic. We get them numbed up, and it's a pretty simple procedure.
All right, we're going right back to our lines right now. Jane is on the line with us. Jane, we appreciate you calling in this evening. Do you have a question or a comment?
Yes. Can a really bad sinus infection cause an abscess in a tooth whose root is close to the sinus cavity?
No, it really can't. People think that they can. A lot of times on an x-ray, it'll look like a root is going up into your sinus. But, you're looking at a two-dimensional picture of what's three-dimensional. And a lot of times that tooth or the root can be either in front of that cavity or behind that cavity. And on the x-ray, it appears as if it's going in there. But even if it is kind of looking like it's going up into the sinus, there's always a membrane going around that within the sinus. And they really can't communicate with each other. Sometimes, rarely, when you're doing a root canal, and the roots are going up into where that sinus cavity is, you can puncture that membrane, and we can see fluids kind of leaking through the tooth. Even that's not a big deal. It heals right away. It's not a concern whatsoever. But a sinus infection really can't cause a tooth to go bad. On that note, I do believe that it is possible that if you already have a tooth that has a problem, maybe the tooth is dead, I think that it can contribute to the symptoms of the dead tooth. If you have a big infection there on the tooth and you have sinus pressure built up in there, pressure against pressure, it's going to be additive. So I do believe that it can contribute to whatever symptoms you may have, but I don't believe that a sinus infection can flat out cause a tooth to die or anything like that.
All right. Well, Jane, we really appreciate calling in, and that's a great question because I've heard that. I'm sure you've heard that from people before. So we do appreciate you calling. Hope you have a great evening.
Thank you.
You bet.
Bye-bye.
Bye-bye. All right. We're going right back to our lines. Like we said, lines are... All right, now, we're going back to the myths.
Oh, great.
Yes, back to these myths. All right, this is myth number 3. A good alternative to root canal treatment is extraction, pulling the tooth.
It's pretty much the only alternative, to be honest with you. If I don't know that it's a good alternative. I think, in my opinion, I have patients that have root canals, and they also have implants and things like that. Almost all of them would rather have. They like the way the teeth feel with the root canal in the crown than they do the implant in the crown. There's a lot of things going on in there. It might be a little bit too complicated for me to get into. There's things called periodontal ligaments, and there's things like that that are involved in that. But root canals is a great treatment. I think that the only alternative to a root canal, if you need a root canal and you don't get the root canal, you need to have the tooth removed. You can have an infection develop in there, and again, there can be a health risk for you as well. But I think that a root canal is generally the better offer most of the time.
Okay.
But there are exceptions to that. There are times where I will tell a patient that if this were in my mouth, I think that this tooth's had it. I think that you're better suited if we just extract the tooth and you can have an implant placed in there.
All right, we do appreciate you watching this evening here on Open Line. Get your calls in, 737-7587. We're going to take a short break right now. We'll return with more Open Line right after this, though.